All right, we are now live. Oh, it's going to record.
All right.
All right. All right. So we are now live. Welcome everybody to SBH Fertility event. I'm going to just accept her in. While they're getting joined, my apologies that we ended up having to delay. Hi, guys.
Hi guys.
So this was supposed to be 2 nights ago. I apologize. That was on us. We both came down with some illness. I'm still recovering. My voice is not quite there yet, but hopefully everything will be okay. I think we'll wait like a minute or two to get started, just to allow some people to log on. I see people are coming on. This is very fun. I agree, Rachel. Nice. All right. I saw that. All right, awesome. All right. How you guys doing?
Good.
Good?
A little nervous.
You already know the story.
I know.
What's your kids?
All right, great.
Sleeping, I guess.
Yeah.
Well,
For sure. All right, great. So why don't we get started? So hi everybody. I'm Dr. Robby Setton, and I'm gonna be have several hats tonight. Firstly, I'm going to be moderating the session this evening, which is going to be focused on diminished ovarian reserve. I'm also functioning as sort of the lives medical expert because I'm a fertility specialist, and I'm also playing the part of the supportive husband for when Mariel tells her story, and also of a friend to our other fellow guests that we have here. So we have on the live with us Mariel, my wife, and we have Freda and Jared Louzon, and we're gonna basically kind of go through. We'll start off just kind of going through a little bit about diminished ovarian reserve. Mariel and Freda will each have a turn to tell their stories, and we'll talk also about the peer-to-peer program and the power of that. And we'll have questions at the end. There should be a question box. If you do have questions, just put it into the box, and at the end we'll try to get to all of them, as opposed to leaving them in the comment section. That's the way that we'll try to do it. All right, so again, I'm Dr. Robby Setton. I'm a fertility specialist at Shady Grove Fertility. I see I'm in the New York office, and we just recently opened in Brooklyn as well, just 2-3 months ago. So we're very excited about that. And I went into the field because of what you're going to hear about tonight. I want to start off by just kind of giving context because many people don't know what diminished ovarian reserve is. So diminished ovarian reserve basically means a low number of eggs, and that's going to be the theme of what we're going to talk about tonight. So, as you know, from a medical perspective, when someone goes in for an evaluation, we look at certain things. We look at the sperm and the eggs and the uterus. And one of the things that we care about with the eggs is the number of eggs. We care about the quality of the eggs, whether or not they're releasing okay, but we also care about the number of eggs that there are. And the quantity of eggs, or the number of eggs, is something that we're able to take a look at with some tests. Some are hormone tests that you may hear about in the stories, AMH and FSH, and we also do ultrasounds to take a look at eggs in the ovaries as well. And as every woman is born with all the eggs that they'll ever have in their life, and as we age, those eggs get used up, and there's no new eggs that are being made along the way. It's not like guys. It's the opposite with guys. It's very inefficient for girls, unfortunately. But basically where you're starting is where you're starting, and they'll slowly get used up. And so we expect for people to have a low egg count. That's a normal phenomenon in 40s, or late 30s, early 40s is when we see those numbers really start to go down. It's not normal to see that happen earlier in life. And that's a theme that you'll be picking up on here tonight. Um, One of the questions we always get about diminished ovarian reserve and or a low egg count is, are there any symptoms that I should look out for that might tip me off to having this? The unfortunate reality of it is that there are usually no symptoms that present. People often will have just regular cycles and have completely normal things. There are certain things in history that could put you at higher risk for it. And then in really severe cases, you may end up getting changes in your cycle lengths and things like that. But typically there isn't anything that we pick up on. And with diminished ovarian reserve, because there's only a finite number of eggs, we typically, and we don't know when those eggs are going to be depleted, when they're going to be used up, we typically go very aggressive with treatment from the beginning to try to make sure that we can reach your family building goals. And again, these are things that you're gonna be hearing about, but I just wanted to give a little bit of context to that. And again, if there's any questions about diminished ovarian reserve specifically at the end, we can address those. But for now, enough of the medical jargon. Let's get to the fun stuff. So without further ado, I'm going to pass it on to Mariel.
Hi. All right, so we'll start at when we decided we were ready to start building our family. It was Robby's, he was in his third year medical school. It seemed like the right time. And we just started to, think about having kids and whatever. And now was the right time. So we're going to start trying. And about 9 months into trying, nothing happened. So we decided to go to our regular OB and a regular GYN and get checked out. And when I got checked out, she said, you know what, try for 2 more months and then I'm going to send you to the reproductive endocrinologist. All right, after going to 2 more months, we went to the fertility specialist and I did my workup. I did some blood tests, ultrasounds. The next day, the doctor called me and said, you have diminished ovarian reserve. We're going to suggest starting IVF, and we're going to suggest starting IVF as soon as we can. He said the best thing that's going to happen to you is, the best thing for your prognosis is your age, and let's start while you're younger, and let's get what we can now. So we jumped head on, and I didn't really know what IVF was at the time. I had never really been. I was, how old was I? 26 at the time, and I never really thought about IVF. I've heard of it before. I never knew what it entailed. So we went to the class that the doctor was giving, and I learned it was not going to be easy. The shots for about 2 weeks of shots, but probably 2 to 3 times a day. And every morning coming in from at like 6:30, between 6:30 and 8:30 or whatever it was, to get your blood taken and an ultrasound. And then at the end of these 2 weeks, you would have something called a retrieval, and they would put you under anesthesia. They would take out your eggs and then fertilize them with your husband's sperm, and it would become an embryo. So I said, okay, I'm going to do what I need to do to build my family. Let's do it. And we decided to start. Okay, we went, we did. And little naive me thought this was it. We're going to get pregnant the first time, and this was going to be my baby. I went in to my first retrieval. I got my eggs, and the next morning I'm standing at my bus stop waiting to go to work, and I'm waiting for, they call you the next day to tell you what happened with your eggs overnight, to tell you if they fertilized or not. And as I'm waiting at the bus stop, I get a phone call. It's the nurse from the doctor's office. I'm so sorry, Mariel. You have no embryos. Sorry. So it's still hard. And anyway, I didn't at the time fully understand all of it and whatever. So I then sat down with the doctor. Okay, what do we do now? And every time this happened, I would take one day to myself. I would let all my tears out. I would go about what I needed to do to get it out. And then the next day would be right back on track. What are we going to do next? And then, so I sat down with the doctor. We're going to try again. Instead of doing regular IVF, we're going to add in something called ICSI, which means they take out a single sperm and they place it directly into the egg. So, okay, great. This is going to bypass your problems. Hopefully this is it. Okay. I went in, I did all my stuff. I went for my next cycle. I got my one embryo and that was it. I was going to have my baby. I did my next transfer, my first transfer. And 2 weeks later, waiting for the phone call. I'm sorry, Mariel, you're not pregnant. Okay, great. Now what? We're going to do it again. Okay. Do it again. Same 2 weeks of monitoring. I go for my retrieval. And again, I get that phone call. I'm sorry, you have no embryos. So now we decided what do we do? We're going to go to a new doctor. We're going to look for a second opinion. We're going to see what we could do from here. So I went to one doctor. I sat down and they looked at me and said, you're going to need a donor egg. Excuse me, what? I don't understand what that even means. You're trying and your eggs are not really working so well. You're going to need to get a donor. I picked up from that appointment. I went home and I turned to Robby. I said, she's not for me. We're going to go to a different doctor. Went to another doctor and he looked at me and said, you're 20, at that time, 27 years old. You have the eggs. We just got to find what's right. Let's do this. So we went and we did, and another few cycles in, and finally finally we did. I'm sorry, the baby's crying in the background. I lost track. We went to do one. You want to go to him one second? I went to start my next cycle, and mid-cycle, the doctor looked at me and said, I'm sorry, you're not responding. And I looked at her and said, what does that even mean? Your body is not responding to the medicine. We're going to make this into an IUI. So we did an IUI that cycle. I'm sorry, you're not pregnant. So again, what do we do now? We try again. Okay. And then we went back. We tried again. Again, nothing. We spoke to the doctor. The doctor said, let's try one more time before we decide to change it up a bit. We're going to figure it out. We went back in. This time we had 2 beautiful embryos. We transferred both embryos and on after my 2 weeks, I was in work. I got a phone call. We're good. We got a phone call. I let it go to voicemail. I wasn't ready to hear it. I went into a quiet room. I picked up the phone. I dialed into my voicemail. Congratulations, Mariel.
I got here for the good part.
You're pregnant. Now I'm not able to control myself. I'm hysterical crying. I tried calling Robby. He doesn't answer the phone. I tried calling Robby again. He doesn't answer the phone. Sitting in a room crying to myself, trying to celebrate. And Robby's not answering. So I called my mom. My mom was out to lunch. She had to get up, leave the table. And I'm hysterical crying. And she goes to me, again, it didn't work again. I said, no, Mom, it did. And then Robby finally called me back. And then 9 months later, we had our first son, Jack. About a year and a half after having Jack, we knew it was going to be hard. We started trying again. One cycle, nothing. The next cycle, nothing. The third cycle, finally we did a transfer. Sorry, nothing. Then off that last transfer, we finally had something to freeze. So we took the frozen embryo and we transferred that back in. It was a few days before my 30th birthday. I get the phone call. Congratulations, Mariel, you're pregnant. Great. This is the best way to celebrate my 30th birthday. We go away for the night with my friends to celebrate. And the next morning, I ran back to go for my blood work. And that afternoon, I get a phone call. Sorry, Mariel, this is not going to be a viable pregnancy. So after all that, I'm crushed again. And then we went, okay, this is not my baby, but we're going to wait and see what happens. After about 9 weeks of waiting to see what happens, we never had a heartbeat. I got my DNC and I try again. I tried the next month I could possibly try, and I wasn't responding to medicine, and there's nothing to transfer. There's no fertilization. You're not making embryos. And the next month again, you're not making embryos. And then we decided, all right, one last time. Let's do this. One last time. One last time, I go in. I get my 2 embryos. I turn to the doctor. I said, it's one last time. Let's do this. And that last time ended up being my twins. Doing pregnancy. After what?
Do you remember how you found out you had twins?
It was Robby's last day of residency. And we knew we were pregnant. And we went into the labor and delivery room triage, and Robby gave me an ultrasound, and there it was, clear as day. There are 2 babies in there.
That's how we found out. We were on the way to like the end of the year, like chief resident graduation party. I said, right before we go there, let's just stop over just to see what's going on. We'll get a sneak peek before the doctor appointment.
And those boys are now my 4-year-old twins. So they'll be 4 in a few weeks. And now we were very happy with our family. We were, thank God, calling it quits on IVF. We were done. We appreciate what we have. We tried very hard. We were taking what we had and enjoying our family. And the twins were about, 20 months old?
Yeah, close to 2. Under 2, for sure, under 2.
I had my twins under 2, and I realized my period was a little late. So I went to the bathroom and took a pregnancy test and then threw it in the garbage going, why am I doing this? What's wrong with you? Why are you doing this? And lo and behold, I walked back into the bathroom, pulled it out of the garbage can for some reason, and it was positive. I had my 4th baby, and we named him Isaac because Sarah laughed when she found out she was pregnant.
Happened to be that parasha.
It did happen to be that parasha when we found out. But we named him Yitzchak because after all of that, we'll be able to get pregnant with another. Thank God. Now we have 4 beautiful boys. And
that's the story.
That's it.
Wow.
After all that time, so 6 cycles IVF, and ended up with our oldest.
Yes.
Another 6 cycles with a miscarriage in between, ended up with twins. And before all this, being told we needed to have donor egg, and then getting pregnant on our own after all that as well. After all that, incredible. I have to say, as both moderator and husband, how proud I am of you. You did great. That's amazing. It's like, and I'm hearing the story and I lived through it, but hearing it again, I have no words, honestly. I'm speechless. So without further ado, because I have nothing else to kick it away, Freda.
Okay. So, we got married I was 26. Jared was baby 23. So yeah, we got married, and 2 months later I turned 27. I turned to him 6 months in, and I'm like, I think we should start trying to have a baby. I think it's time. He looks at me. What'd you tell me?
I'm in law school. You're crazy. Leave me alone.
Yeah, law school. You knew that when you married me, and I said, yeah, and I'm old. You knew that when you married me. Like, I wasn't baby, and I was ready. We agreed to wait a year. Okay, fine. We'll wait a year, and we'll start trying. And so the year passes, and I become like a type A personality. I'm going to get off birth control for 3 months, going to get my cycle regular. I'm going to take ovulation tests. I'm going to make sure I'm doing this right. Like, if I'm going to do this, I'm going to do this right. And
she was on a mission.
Yeah, I was on a mission. So 3-4 months passes, and nothing's happening. And I'm like, I did everything right. Like, thinking about probability, I should be pregnant by now. Okay, let me go to the doctor. I tell the doctor I was trying for like 6 to 8 months. He's like, don't worry, let's take some tests. We'll see what's up. We take some tests. He's like, you're fine. I'll see you within the next 6 months. You'll be pregnant. You're fine. Okay, great. I'm fine. A month later, lo and behold, I'm pregnant. Amazing. Dad looks at me, oh, it was all in your head. You were so nervous. I was nervous, okay, but I got pregnant. We're so excited. We have our ultrasounds. We see the baby. We see the heartbeat. We tell our parents, 8 weeks pregnant. I'm so excited. The next day I wake up. I'm like, Jared, I don't know. Something feels off. Like, I just don't feel pregnant anymore. He's like, it's all in your head. You're all just don't Google anything. Don't do anything. Just proceed with life. So I do. I'm like, I don't know. I just don't feel pregnant, but nothing's happening. So I guess I am. And 2 weeks later, on a Sunday night, I start cramping and spotting, and I'm freaking out now. Freaking out. I'm shaking. What do I do? I call my mother. Ma, what do I do? She's like, call your doctor. Figure out what's up. I call them. They're like, there's plenty of reasons why people could spot and cramp and all that. If you're bleeding through a pad, come in. Okay. Somehow managed to calm my nerves, go to sleep. I wake up the next morning, things are okay. I'm like, okay, I go to work like a regular day, have, meetings, doing things. and I'm in the middle of a meeting and I start cramping like something really scary. I was just like somebody punched me. I went to the bathroom. I saw that it wasn't good. I finished my meeting. I called the doctor. They told me, okay, come in. My mom meets me there, and we go for the ultrasound, and I see what I'm not supposed to be seeing. I don't hear a heartbeat, and the sonographer, she's silent. She's like, let me go get the doctor. I turned to my mother. I said, that's not good. She's like, you don't know. I'm like, yeah, I know. I see the screen, and I see what it's supposed to look like, and that's not what the baby looks like. Baby didn't grow. So they confirm you had a miscarriage and happened at 8 weeks, and now I'm inconsolable. I'm with my mother at the doctor. They're throwing options at me. I couldn't even hear them. Jared was on the phone. I'm screaming, I lost the baby. And they throw meds at me. I don't know what I'm taking. I take them. I'm cramping at home. I'm in excruciating pain. I'm pretty sure I passed the fetus at home, and then they were told me to go to the place for a DNC anyway. So I did, and I did the DNC. And I told some friends, and everyone's like, "Oh, usually when you have a DNC, you're like super fertile." So I got my hopes up, and I said, "Okay, it'll happen again. It's gonna happen. It happened last time. It'll happen again. It didn't take so long. I know what I'm doing." Again, ovulation tests. Type A, getting everything done, and nothing's happening. I turned to Jared. I'm like, I think I need to see like a specialist. I think I need to go somewhere. He's like, you crazy? I tell my mother. She's like, no, there's no need. You're fine. You got pregnant. You were fine. It happens. I'm like, no. I'm gonna go see it. I'm gonna go see a doctor. So someone in my office mentioned his wife went to a fertility specialist. And I was like, all right, give me the number. Like, I don't know anybody else that had anything, so I'll take this number. I take the number down. I go and make an appointment. I see the doctor. He takes, does an ultrasound. He talks to me about my history. And he's like, it sounds like it could be endometriosis, but we'll take some blood work. We'll see what's what, and we'll figure this out. Okay, great. Now it's a day before my 29th birthday. I'm at a company picnic and I get a phone call. I missed it, so I went to voicemail, and the nurse from that fertility place is telling me, I'm so sorry, but your AMH is very low. She put a number. She said, oh, it's 0.38 and your FSH is 23, and I'm so sorry. The doctor wants to see you in. What does that mean? My AMH is what? My FSH is, what is that? I don't even know what these numbers mean. Like,
do you remember that night? We were Googling like the entire night trying to figure out what this is.
What is
this
this?
AMH is this. Oh, I think I figured it out. No, don't worry, honey, we're okay. And like I'm trying to calm her down.
Yeah,
even the next day in work, I'm looking it up. Like, no, we're totally fine. We're totally fine.
Yeah. He tells me we're totally fine. We weren't fine. We were not fine. Those numbers are not fine. But he tells me, go do your HSG, check your tubes, check his sperm, check your AMH levels on day 3, check everything, and then we'll have another meeting. So we do all that. I have another meeting, and my mom is with me again, and he tells me, your AMH is supposed to be at 1, you're at 0.38, your FSH should be at, what did we say, 8, and you're at 23. So you're like a premenopausal woman. He told me you have the eggs of like a 40-year-old. I was like, I got pregnant on my own. Hi, I was having a baby. Like, it didn't take me that long. What are you saying? He's like, you need IVF and you need it yesterday. And we're only gonna try, 2 times, and if it doesn't work, we're gonna go to donor eggs. Donor eggs? Like, I was just pregnant. Wasn't I just pregnant? I just got pregnant. I was pregnant this year. He's like, yeah, but it didn't last. So, maybe the quality, you don't have good quality. I was like, and then he's scheduling me in to his nurse. Okay, we're going to do IVF this day. We're going to start here. Here's your process. Here's your insurance. Here's the medication you need. And I walked out of there and I'm like, no, sorry. Nope, not going to you. I had a friend who told me that her cousin spoke to A-Time and Bonay Alam and got her referrals for doctors and stuff. So I started making phone calls. I'm like, I'm not using that doctor. He's cuckoo. Let me see what I could find out. And I had a notebook and I'm writing all my notes and calling A-Time and talking to people and Ronelam, and they told me, go to this doctor. He's great for what you have. I called and I got an appointment, and that's it. We got started. We met with him, and he was like a totally different tone. He was, you're young. Yes, you don't have a lot of eggs. Yes, IVF is not easy, and it's you're not going to get a lot of eggs, but we're going to make this happen. And I left there with like a totally different feeling in my body. Like I was almost relieved. He was the only guy that was saying, like, we're going to get you a baby. So we did all the classes, we got all the meds, they told us, you know, do this, do that. We jumped through every hoop we can. We started IVF November of 2015. And so Jared was the pharmacist. He was the guy giving me all the meds. I was the doctor. You were the doctor. You were the whatever. I wouldn't touch the meds. I saw this box of meds that come. It was the size of like half my body. And he took care of it. He was like, okay, we'll mix this with that and we'll shake it. It needs to be hot, it needs to be cold, you need to put it there. I'm like, you do you. I'm just going to be the push cushion, whatever it needs to be. Like, I'm not paying attention to that part.
Sounds like the nurse.
Yeah, he was the nurse.
I was the nurse, yes. With the pink paper that gave you the instructions on exactly what to do to mix this thing into that thing. That was my job. Yeah,
that was his job. I'm like, I do everything else. You figure that out. So first night we took shots. I was a big girl. Took it, handled it like a champ. Second night, what happened?
She ran away from me. Hysterical crying. I'm not doing this. I don't want to do this. I don't understand why I have to do this. Leave me alone.
Running away. Legit. Went into the other room, closed the door. Not doing this. This is not for me. Not for me. This is not how it's going to happen. I don't know, somehow you, I don't know, got me to take, sit with the girl and take the shot. So, okay, we did
mind you, she's going, it's not only the shots at night, she's going in the morning to get blood tests and ultrasounds, and she's getting up early, and then we're doing these shots at night. It's just, yeah, it's a whole day event.
We had to get up before work.
Right.
So work started at 9. I had to get up before work, get there. And you were driving me.
In the beginning, I was going with her.
Yes,
I was going with her, and you go to the clinic, and I want to say there's hundreds of people. Yeah. Like you get there, and it's just overwhelming. Hundreds of girls trying to do in vitro, and get in or IUIs, and it was just incredible.
So yeah, you drove me the first time, the first round. We were like newbies at this, you know, everything's gonna be fine. We parked, we went in, we waited an hour, we did whatever we were supposed to do the first time. We thought, okay, just like you, we're gonna do it one time, we'll get some eggs, somehow we'll get something to be saved, and we won't ever have to do this again. And boy, were we wrong. So the first round was just the flop. Okay, we took our eggs out, we got one back, we put one back, it was negative. I cried. I drank a lot at New Year's party, and we tried again. Okay, February, we tried again. It was a little bit better of a cycle. We got more eggs. We put 2 back, and again, negative.
That was Clomid.
It was a low dose Clomid type, but yeah. And it didn't work, and I was pretty devastated, obviously. And so the doctor decided, let's do a hysteroscopy. Maybe you have a polyp, maybe you have something in there. Let's check it out inside. They basically went inside and checked to see like my uterine cavity, I believe. And they found a polyp, they removed it. And we did a cycle. And that cycle, we got like a very good response. And we put 3 back. I was actually sitting on the transfer table on our 3rd anniversary, and we put 3 back. And as they were putting them back, I told the doctor, yep, we want triplets. Like, they're like, that's not what we're going for. And I'm like, yeah, it's fine. Third round of IVF, we'll take triplets. It's fine. But we didn't get triplets. We did get a positive pregnancy test, and that is our son. Joseph. 9 months later, he was born. Yay, it worked. But I have to tell you, 8 months into that pregnancy, I called the IVF doctor and I said, when can I start again?
That she was on a mission.
I didn't have anything saved. So what was I going to do? I needed to start this again. Like how early could I start? He thought it was a little bit ridiculous, but he's like, just wait three cycles and, then we'll start. And he was born. We enjoyed him. We were so happy with him. Like, he's so freaking cute. Like, I have to have another one. And so I guess he was 6 months old and I started again. This time I figured it would be a little easier. I knew what to expect. Wasn't as nervous. I kind of treated it like going to the dentist.
I stopped going with her.
Yeah, stopped going. It was like, all right, you have like one task or two tasks and that was it. I'll do the rest. So we started again. We had one cycle. It was negative. I was pretty devastated. But I had my baby at home and I held him and I cried with him and I got over it. Okay, it will work. Then I tried again. The response was not really very good. We switched to an IUI. And then it was negative. I tried again. That one was canceled. Yeah. And also, I forgot to mention, sorry guys, I'm like going out of order, but I forgot to mention like when I met Mariel in the whole process. Because like integral process. So it was after my first cycle that Mariel and I connected. And she really like put everything into perspective for me. Because I thought, I was Googling and thinking to myself like, oh, these people got like this many eggs and they had all those to freeze and oh, I could have that too. But it was a very unrealistic expectation. And then talking to Mariel, at the time you only had Jack and it worked. And I was like, okay, there's living proof that, we have the same kind of AMH, FSH, like we had the same. How
did you find each other?
I had a friend who contacted her sister-in-law. Her sister-in-law said, oh, I know someone doing IVF. She contacted somebody else and somebody else heard my story and she's like, oh, I have someone perfect for you. You have the same thing. So that's how we connected. And
be someone that Mariel had incidentally bumped into in the waiting room in that facility.
Yep.
Yeah. There wasn't a lot of people that we knew there, but it was, you bump into people here and there.
Yes.
And really like my whole perspective changed. Like I was like, okay, this could happen. This is how many times it took Mariel to get pregnant and have a baby. So like my expectations were like more realistic and I had a focus. I was like, okay, let me figure it out. So much so that I even asked the doctor to follow some of her protocols. I'm like, I know somebody that, she got twins, so let's follow that. He's like, so anyway, in the middle of trying for our next baby, I believe you guys had your twins. Twins were born January. And we went to the bris. And I remember going to Robby at the end of the bris as he's giving out his berachot. And I'm like, Robby, we're trying to go for the Robby and Mariel special. So bless away. That's really what I did. I remember that. And I was like, okay, it's going to work. So you remember that. So we had like 3 cycles that weren't working. We started again. Again, like another cycle happened. It was negative. Another one canceled. Another one, we're just going to do a timed intercourse. Okay, fine. Nothing worked. And I'm really like, it was 6 cycles later and I'm giving up hope. I'm just like, maybe we should just have 1 kid. Maybe it's fine. I don't know. And they said, let's try this natural cycle. Let's try this. We're going to go in for 1 egg and maybe we'll get one good embryo and that'll be your next baby.
Natural cycle meaning
less medication. It was a natural cycle.
You don't start with any medication. You start off with nothing. And then once you have a follicle, then you just add in a little tiny bit of medicine. Yeah,
exactly. It was a lot easier. It was a lot easier to manage. It was just a lot of monitoring. And I was telling Jared and my mom, I'm like, this is so silly. I'm going in for 1 egg. I used to go and get 4 or 5 eggs and have like chances. Like this is just, I'm going in for 1 egg. spending all this time, energy, emotion, money, everything for this one egg. I felt very, very silly. And so in the middle of monitoring that one egg, they found another one popped up. And they're like, all right, maybe we'll go for 2 eggs. And I was like, all right, okay. And we're going through the cycle, and it was time to trigger. The trigger shot is what you take before you go in for your retrieval. And
it basically releases the
eggs.
Egg.
Okay.
Yeah.
And I get the call, and they're like, okay, it's time for you to trigger. And I'm like, crap, Jared, I'm not triggering. It's too early. Why did I think it was too early? I don't know. I was just nervous. It's too early. I need another day. I call back. I leave a message for the doctor on call. I'm like, nope, not triggering, not happening. And the doctor on call was Robby.
Hi.
Calls me back.
And what can I do for you?
Josh, I know what happened to you in the past. You're triggering. It's going to be okay. And Mariel texted me on the side. I think he knows what he's doing. He knows what he's doing. He knows. Don't worry.
You were like, she doesn't know what he's talking about. You're like, it's too early to trigger. You knew.
I don't know. We were just very worried. It was just like, I don't know. I'm like, okay, it's probably gonna work. Let's see. Robby said it's gonna work. It's gonna work. Okay, we trigger. We ended up getting 2 eggs. They both fertilized. We put 2 back, and yeah, they both stuck. Yeah, I got my big bag positive. It was positive, and Mariel's texting me, it's positive, it's positive, it's positive. Look, Robby did it. It was Robby. Robby did it. I'm like, I know. I really need to stick my foot in my mouth. So this is on live, telling everybody I need to stick my foot in my mouth. Yeah. So it was positive, and I got pregnant with twins.
But in the beginning, we didn't know if it was twins.
No, we didn't know it was twins.
So remember what you were doing?
What was I doing?
She was Googling, what was it? The
HCG number.
Right. She was Googling like
Google a lot.
Yeah, who doesn't Google? Come on.
She was Googling like the
numbers.
the certain hormone to see if it's like determinative of whether it's twins or not. It was
yeah. So
crazy.
when you get your pregnancy test, they tell you, oh, your HCG is this number. Mariel's like, it's very high. It's very high. It's good. I think it's twins. I think it's twins. And she knew I wanted twins. I was like, I don't want to do this anymore. I wanted a big family. What?
I thought you were crazy for wanting.
Yeah, I was a little crazy. I'll admit it. But how many times do you want to do IVF? Like, let's just get the twins, be one and done.
That was our goal with that cycle. We wanted to be done. We wanted to be done with IVF. Like, that's it. We're done. Because we were talking about doing it again if we didn't have twins.
Really?
Yeah. You don't remember?
I don't remember, but I do remember. We weren't sure if it was twins until I went to the ultrasound, and of course I went with my mom because Jared was too busy to take off of work. And like, I'm holding my mom's hand, and I see these 2 little circles, these tiny little circles, and I'm like, oh my God, it's twins. Like, there were 2 eggs, and we took out 2, and it's twins. We got two. And crying, we're hysterical crying, both of us, like, oh my God, it is. And the doctor's like, you know, a lot of times early in pregnancy, like one disappears or whatever, like, let's just see. And so we kept going to the doctor, and there's still two. And like, every single time, you know, we went to the doctor, I'm like, there's still 2. We're counting them. There's 2. There's 2 heartbeats. Everything's good. And yeah, so we had not such an uneventful pregnancy, but thank God a very healthy pregnancy. And at 33 weeks and 4 days, my water broke, and popped out a little girl. That's our Arlene, the cutest little girl. And then 2 minutes later, we had Alan. And there we go. We were a complete family, crying hysterically on that emergency room as we gave birth. Operating room. That's it. We have our family. We're complete. We're done. So happy. And the doctor at my 6 weeks visit, he's like, okay, let's talk about birth control. And I was like, I am birth control. Do you need birth control? I was like, I don't need birth control for what? He's like, you don't know how many times I deliver, you know, IVF after IVF babies. And I was like, all right, I'll take the chance. And Mariel also was pregnant with Isaac. and telling me, you know, you need to use protection, you know. I was like, for what? For what? Not really necessary, I don't think. And you were 9 months pregnant with Isaac, and I texted you that I was pregnant. I laughed in my face.
What'd you say?
The babies were not even 2. So Joe was 3. The twins, no, Joe was 3 turning 4.
Right.
Turning 4 when I gave birth.
Mm-hmm.
So he was 3.5 when I found out I was pregnant. My babies were not even 2 when I found out I was pregnant. And yeah, we ended up now having 4 babies.
We
We
found out the morning of your sister's wedding.
Yes. I found out the morning of my sister Nancy's wedding.
And
I wanted a drink. I said, I don't know, something was up with my period. It's bleeding high and go seek. And one of my friends was like, you know, that could be implantation bleeding. And I yelled at her. I'm like, it's a myth. There's no such thing. They talk about implantation bleeding, but I never saw such a thing. Did you ever hear of anybody having that? No. I went, I took a test, and lo and behold, it was the fastest positive I ever saw in my life. And I went to Jared. I'm like, we're pregnant.
and I left.
Yeah.
They left.
He named your son Isaac because Sarah left when she heard she was pregnant. I left. Like you really understand it when you're in that moment.
Yeah, it was pretty crazy. And I still like didn't believe it up until the day he gave birth. I'm like, he's real. It's real. Like, I got pregnant. I did. It worked.
And what'd you name him? We
named him Zachary. And his Hebrew name, I wanted to name Yitzchak, but Jared kept yelling at me that that's not the Hebrew name for Zachary, that it is Zachariah, because that's the name. That's just the name that you use. And my father-in-law kept telling me, kept calling him Zachariah. And I was like, Zachariah, that's his name. And he's like, it means God remembered. And I was like, that works. He did. God remembered us. Like, okay, we got our family. He remembered, and we are complete.
And that blessing at the bris.
There you go.
we got the full Mariel and Robby special.
Crazy.
And now we see each other, and what do you tell us? That we're you an hour later.
Right.
Yeah.
Right. Exactly. I mean, both these stories are, in my mind, are so incredible. And I think they really highlight, so I try putting on my moderator hat, like the power of one, perseverance, but also really, I think what's really special, I think about the story, and the reason that we wanted to one of the impetus for talking about this is really, you see that when Freda started to go through her journey, she had connected with Mariel sort of through these, weird, back ways. This is before SBH Fertility existed. And they literally talk every single day now. I'm not even joking. They talk all the time. And they were really assets for each other. And even on our side, going through the second cycle, I remember Mariel talking, leaning on Freda a lot when she was going through things, because there were some things that came up that she had experienced that we hadn't experienced yet. And it really changes, your experience of going through things. And I don't know, Jared, what was your sort of take on things in terms of having that? Because it's hard for the guys. It's hard for the guys.
I mean, I knew my job was I had to stay positive. I had to stay hopeful. She was so emotional. So it was really an emotional roller coaster, because you go in and you're so hopeful, and then you get shot down, and it's back and forth. And my job the entire time was, this is going to happen. I believe it's going to happen. That's so I would tell everyone, I just like, here, this is what I'm going through. I didn't care.
We weren't shy about our story.
I love when people ask me, it's my favorite question, oh, do you have twins that run in your family? No, I don't have twins that run in my family. They're in vitro twins. And, it opens that conversation. So like I would tell all my friends. I had one friend who was going through something similar. So we used to talk a little bit about that. But Yeah, like I said, my job was keeping her on track and giving her the shots.
Right.
Yeah, he was.
It's important also, I mean, like what you're saying is because there's a lot of stigma about it, about no one wants to be going to the doctor to have a baby, right? And no one wants to talk about the fact that they have to do that. But a lot of people do. And this is just one of many different reasons for that. And you know, it's nice when we share these stories because we both ended up being successful, sort of going for two, but both ending up with four. You know, not every story ends that way. There are journeys that take many different paths. But no matter what, there are people out there that have been through it. And when you first start going through the journey, and you both sort of express this in your first cycles in particular, when it's sort of the most scary and there's a lot of fear of that unknown, it's very, very isolating because you feel like you're sort of going through in a bubble because it's all brand new to you. And so how can anybody understand what it is to, you know, being chased around your apartment or your house with by your husband with a needle, you know? You know, but it's by the way, Mariel did not give herself a single injection through all those cycles. It sounds like Freda did not do the same either.
She did. She did. When we were pregnant, with Joe, she was going away. So one thing we didn't talk about is so you have shots in the beginning to try to get pregnant, which stimulates the growth of your eggs, etc. Once you get pregnant, you graduate. So you go from this little tiny needle and you graduate to this gigantic needle that you have to put in the butt.
Yes.
Yes, and he decided. So we had a fight about this because it was the third cycle, and he's like, "You need to learn how to do it yourself. A progesterone shot this big in my butt. I have to do it to myself." I'm like, "No, just come with me on the trip. Just come." And whatever.
I was studying for the bar, so there's no shot I'm coming on the trip. It was like a month before. I said, "You got to learn how to do it."
So wait, so we're fighting with each other because I didn't want to give it to myself, and I don't even know if I needed to give it to myself because my pregnancy test was on a day where I was leaving for Vegas, so I needed to find out beforehand if I was pregnant. So we're yelling at each other on Friday night, like, "You give yourself the shot." "No, I'm not going to give myself the shot. You just come with me. Just do it yourself. You do it. I don't know if I need to figure this out myself." The next day we took a pregnancy test, and it was earlier. It was before the clinic's pregnancy test, and I saw a faint positive, and I was like, "Oh, I guess I do have to give myself the shot." And we actually, I tried one night and I gave myself the hugest black and blue because I'm not a contortionist and I can't go around and do that. And we also had to do it the next night. He was yelling at me at our friend's wedding. We went into the bathroom, locked the door, and he's yelling at me, "Give yourself the shot." What is dressed? And I'm like, "F you, I'm not doing this. Just give me the damn shot." And I'm going away, and I think my boss is like, "Am I going to have to give you shots?" I'm like, "Relax. I figured out an alternative. We'd use suppositories, and we figured it out." But it was really...
Everyone going through treatments has some story that they can relate to like that. We're running short on time. I want to give a couple of seconds just for questions here from that couple in the question box. Let me just take a quick look here.
Where's the question box?
No, they don't.
I have the question box.
Got it.
We have a question. Is there any reason someone with DOR would have less successful transfers once you get a healthy embryo? So it's a great question. So this sort of comes to the question of the way we think about eggs in terms of egg quality and egg quantity. The quantity of the eggs is really what dictates the diagnosis of DOR. And then the question then is for the embryo, in order for the embryo to implant, the embryo has to be a good quality, meaning it has to have the right number of chromosomes and has to basically have a good reproductive potential or the ability to result in a baby. Now, with DOR, there sometimes can be a decrease in the quality of the eggs. It's something that actually is debated a lot in our field. But there may be a quality issue component that goes on with that as well. So the question that comes up, right? So we both our stores, we went through several transfers that weren't successful. It's likely because the eggs that we would get, because you basically are just getting whatever eggs are coming forward that month, but not every egg is going to be normal. Even if you don't have a diminished ovarian reserve, not every egg that comes forward in a cycle is normal. Because when people get pregnant naturally, as Freda did, they sometimes have miscarriages because the quality of that egg may have been abnormal. The issue with diminished ovarian reserve is that as opposed to someone with a normal reserve, if you get 20 eggs during an IVF cycle, the odds are you're going to find some good eggs there. If you're only getting 2 or 3 or 4, then one of those might not be a good quality. So that's sort of the reason for that.
Right. 1 second. Had you both been pregnant with your 4th? Naturally with your 4th? We have a joke that Freda and Jared are us about a year later, and it's not impossible to get pregnant naturally with diminished ovarian reserve. It's just not easy.
I think it's the pressure of it all. You know, you just once you don't have to worry about it anymore, it's a little easier to happen. I don't know. It's
Yeah, there's not really a good explanation.
Right.
The odds are low. The odds are low. So all with diminished ovarian reserve, it's really IVF just increases your chances. That's all we're doing, just playing odds in a way. And so, you know, it can happen naturally, but it's very, very difficult. Nobody knows. Maybe something about going through the IVF process, being pregnant, sort of gets the engines revved or something like that, and just it was able to happen. I mean, we have anecdotal evidence of it here, but no one knows with 100% certainty, like from a medical perspective, why that is. There's a question, do you have a higher chance of getting pregnant when getting eggs from a donor? Absolutely. With donor eggs, that has probably one of the highest success rates of all of the interventions with IVF. Every embryo transfer with donor egg has over a 50% chance of working. So that certainly has the best prognosis. There's another question in the box. Is cramping and spotting normal? Are they band signs? Did you bleed a lot through that meeting? I think that's it.
No, that's from the DN.
Wait, say that again.
Was the cramping and spotting normal? Are those bad signs? Did you bleed a lot during that meeting?
So for me, was it normal? That's for me. And yes, thank God I always have a reserve of, feminine products with me somewhere, even if I'm pregnant. And it was not fun.
I'll say that the amount of bleeding that you have, it's and pain and things like that, while it is a worse prognosis and puts you at higher risk, it's not definitive. I've seen, in our practice, I mean, we see this all the time. Bleeding in early pregnancy is very, very common. And there's sometimes where there's just a little bit of spotting and unfortunately results in a miscarriage. There's sometimes where there's so much bleeding that it's like you have to clean up the floors after, and they go on to full term. So the amount of bleed, I wouldn't go by that. You just have to, it's just something you have to get checked out for and wait, unfortunately.
Mm-hmm.
I think we're right close to the end of time here, so we're gonna cap it off. Very, very special thank you to Freda and Jared. It is very difficult to get up here and share your story and talk about some very personal things that you've gone through. And of course, to my wife Mariel, for everything that she went through. For everything she went through to help build our family. And a very special thank you to SBH for having all of us here. Please remember that while Mariel and Freda ended up finding each other, there is what's amazing now is that we have something in place for that in our community. And SBH Fertility is a huge resource for women going through fertility struggles. Whether it doesn't, and the fertility struggles really range from a very, very broad spectrum. There's, this is obviously very, very intense, many IVF cycles. You don't have to just be doing aggressive IVF to have real emotions and real needs and real support when you're going through a fertility journey. It can be even the most basic thing with the most simple diagnosis or just anxiety that you have and you're at just starting to try for your first month. So you're never wrong to reach out, and I would encourage everybody to do so, because it really, really is a fantastic program. And again, thank you again to SBH for all that you do.
Thank you.
And
Fun.
have a good night, everybody.
Thank you.
Good night.
Bye,
Thanks,
guys.
guys.
All right.
How do you
Bye-bye.
say that?